15 Weird Signs of Diabetes. In this video, I'll discuss signs and symptoms that appear when your blood sugar is high. First, do you know what high blood sugar means? The American Diabetes Association says we can identify this through 3 diagnostic tests. I'll show a table to explain, then discuss the signs and symptoms. The first test is fasting glucose, done after 12 hours without food. Normal is up to 99, 100, 125 is prediabetes. 126 or higher indicates diabetes. I'll give values in mg, dl, and mmol, as some places use different units. Another diagnostic test is HbA1c, showing average blood sugar over 90 days. This test is normal up to 5.6, 5.7 to 6.4 is prediabetes, and 6.5 or higher is diabetes. Another diagnostic test, the third and final one that can be used, is the oral glucose tolerance test. For this test, you go to the lab fasting, have your blood glucose checked, and then drink 75 grams of glucose. 2 hours later, another blood test checks how your body handled the glucose. Fasting glucose is measured, and 2 hours later, up to 140 is normal. 140 to 199 indicates prediabetes. 200 or more means diabetes. Those are the key values. Remember, prediabetes can cause various changes, like diabetic neuropathy, an early sign of diabetes. Nerve changes can occur with blood sugar at 110 mg/dl. Isn't that interesting? Changes happen even with slightly elevated sugar. How does it show up? It might cause tingling in the legs, for example. It can involve changes in sensitivity. That's why diabetics often don't notice wounds, which can become serious due to reduced sensation. Other signs include diabetic neuropathy, where patients feel a burning sensation under bed sheets. Changes in sensitivity or tingling can indicate high blood sugar, even if only slightly above normal. So be very attentive. You need to get tested to determine if you have diabetes. Another sign of slightly high blood sugar is a skin condition called acanthosis nigricans. I'll show a photo to help you identify it. It's dark, velvety patches that appear in skin folds, like the neck or armpits. This can indicate insulin resistance. When your body can't process blood sugar normally anymore, it tries to compensate by increasing insulin production, entering a process we call insulin resistance, meaning you have insulin, but it can't do its job. What's insulin's function? To take sugar from the blood and put it in muscles and tissues for energy. At this stage, a skin sign may appear. Have you seen anyone with this? Probably because it's very common. If you haven't noticed it yet, you'll start seeing it now, because I often see people on the street with this sign called acanthosis nigricans. Remember, most cases are caused by insulin resistance, but tumors in the digestive system or esophagus can also cause this, though it's mostly due to insulin resistance. The third strange sign of diabetes, which is also quite interesting, is that these signs are really different from the commonly discussed ones, yet they're still signs of diabetes, namely slow digestion. Why? When blood sugar is high, it can impair our gut motility, changing how your body digests food. This can manifest as feeling overly full, slower gastric emptying, or feeling stuffed after eating little, because there can be this change in intestinal transit. Often patients tell me, I eat little, but it feels like I'm at an all-you-can-eat buffet eating a lot. If this happens to you, you should also check your blood sugar levels. Sign number 4, which is quite interesting, is reactive hypoglycemia. What is it and why does it occur? Hypoglycemia means low blood sugar levels. But why can it be a sign of diabetes? Because when the body has insulin issues, it may produce too much insulin. If you eat a meal high in carbs and sugars, your body might produce excess insulin, causing reactive hypoglycemia. How does it manifest? With hand tremors, cold sweats, and heart palpitations. This can precede type 2 diabetes, so it's very important to be aware of this. If you eat a carb-heavy meal and experience hypoglycemia symptoms, even with low blood sugar, it could signal impending type 2 diabetes. So be very careful with this. Though it's a sign of high blood sugar, it can manifest as this curious and strange condition called reactive hypoglycemia. And number 5 is about urine. When blood sugar rises, especially above 180, your body starts eliminating sugar through urine. The kidneys do this to try to compensate. And then you'll have this symptom of excessive urination. You'll be going to the bathroom frequently. But the odd sign I want to highlight is that this urine, as you're losing sugar, will be sweet. This can attract ants. Sometimes urine residue in the toilet, being sweet, can attract many ants. Or in the trash, used toilet paper, for example, might also attract ants. Not just in the toilet, but in the trash too. Ants in your home's garbage? Get tested for diabetes. Sign number 6 is about vision. Blurred vision and decreased visual acuity. You saw fine before, now it's harder. Not just diabetic retinopathy, a common chronic complication, but also because rising blood sugar levels cause glucose molecules to pull in water. This can lead to vision changes. Blurred vision? Get your blood sugar checked. Sign number 7 is about wound healing. A wound that took 7 days now takes 14. That's also a warning sign. Our healing can slow down and be compromised. Cells responsible can suffer from high blood sugar. Sign number 8, which is also unusual, is weight loss. Yeah, but why weight loss? Because insulin is our most anabolic hormone. It's the hormone that gives you energy and helps you survive. If your insulin is altered, your body won't properly use the food you eat, and weight loss is one of the signs. Unlike other signs I mentioned that occur with slightly elevated levels, this one doesn't. Weight loss due to diabetes happens at a more advanced stage, or in early type 1 diabetes, an autoimmune disease. Symptoms appear much faster, like in 15 days. In advanced type 2 diabetes, the body can't process insulin and starts losing weight, okay? So if you have high blood sugar, are losing weight, or don't know you have it, get checked. You might have had a recent worsening, or it could be type 1 diabetes, which can show these signs and symptoms like weight loss early on. Sign number 9, extreme fatigue. You wake up tired and everything seems to take more effort than before. You used to climb 4 flights easily, now one leaves you exhausted. So check your glucose metabolism, because having high blood sugar doesn't help if your body can't use it. If you're not using that sugar for energy, it's a problem. And one of the most common signs, in fact, is tiredness. Okay? Fatigue can be due to various issues like anemia or heart problems. But since diabetes is common, checking blood sugar levels is essential. Sign number 10 is infections in the mouth area. In the gums, for example, there's a condition called periodontitis. A study found people with this oral issue were 3 times more likely to have heart attacks or cardiovascular problems. So, oral health can be a crucial clue in diagnosing and treating diabetes. If you've had a dental implant, you know dentists ask about diabetes, as it can affect recovery. Dentists often refer patients with high blood sugar to me to lower levels before safely proceeding with treatments. So the mouth can be a very interesting clue. If you've never had gum infections before, but now have constant inflammation, that's a red flag. Sign number 11 is excessive hunger. As we saw, the body can't utilize blood sugar properly. Since our brain doesn't fully grasp what's happening, it signals you to eat more. Well, if you're not getting energy, one solution is simply to eat more. In medical terms, we call this hyperphagia. It's common for diabetics, especially those with high blood sugar, to feel very hungry. Does this happen to you? Many patients think there's no connection. When I ask directly, most admit their hunger has increased. Isn't that interesting? Sign number 12 is excessive thirst. To offset high blood sugar, your body makes you thirstier, prompting you to drink more water to balance it out. As levels rise, fluid volume increases. This dilutes blood sugar levels, potentially improving your condition. The body uses this as a compensation method. That's correct. It's one approach. If you've had high blood sugar and went to the ER, you'll recall the doctor's first step was hydration. They either gave you an IV or fluids to drink, because yes, it's a way to compensate. Also, our kidneys will expel more water. As they eliminate glucose, as we saw earlier, water goes with it. So you tend to become more dehydrated. This will also make you thirstier. Diabetics get dehydrated more often due to these mechanisms I explained. Sign number 13 is a change in breath odor, also known as halitosis. Why does this happen? When the body can't use blood sugar due to lack of insulin or its malfunction, it may use another energy pathway. This pathway, breaking down fat instead of sugar, can produce what we call ketone bodies. One way to eliminate these ketones, toxic in excess, is through breathing. This manifests as a change in breath odor. So, bad breath. Did you know about this sign? It's a pretty strange sign, isn't it? You see, diabetes isn't just about the common signs and symptoms. There are many other changes an endocrinologist can explain to you. Number 14, which is often discussed, is how high blood sugar levels can affect hormones like testosterone. We know this can decrease the production of luteinizing hormone, LH, for example. So, what's the frequency of hypogonadism, you might ask? It's when testicles or ovaries have issues and can't produce hormones properly. This becomes more noticeable in men through low testosterone levels, but women can also experience menstrual irregularities. So, hormonal changes you see as glucose alters our body and insulin levels can affect various organs and functions. And sign number 15 is an increase in infections. For example, skin infections, fungal skin infections, or recurring urinary tract infections. You've never had a UTI, or you did, but it always cleared up. Now you get recurring UTIs that don't seem to improve. This could be due to diabetes. Despite having enough infection-fighting cells, high blood sugar makes them malfunction. This increases the frequency of skin or urinary infections, for instance. On a scale of 0 to 10, how would you rate this video? If it's a 10, I'll make more videos like this. Also, mention if you've had any symptoms I listed or others. I could make a video about 10 more diabetes signs and symptoms. Comment and I'll tell you if it's a diabetes sign or not. Now, I'll suggest another video for you to watch. It's about the best foods for people over 50. If you're in or past this age group, certain foods can boost or maintain your health. In that video, I discuss the best foods to eat. Take care. See you next time.